I describe those initial moments as being in a movie and the sound goes out. You're going through all of the regular motions of your life, but not really living it. You're understanding it, but it's very surreal and it's not sinking in. I didn't have a choice whether or not I had cancer, but I have a choice how I respond to it. My name is Kandis DeColle. I am a site manager at MIC Medical Imaging. I have worked with MIC since 2002. I started my work experience as a sonographer. I worked as a team leader in the ultrasound department. I've been a clinical educator in ultrasound, and now am working as a site manager. In February of 2024, I had my very first screening mammogram when I turned 50. And during that mammogram, I found out that I have dense breast, category C density. I had a normal mammogram, and then my images were reported as normal, but noting that I had dense breasts and that ABUS, automated breast ultrasound scanning, would be of benefit to add as a supplemental screening for my patients like myself. So I booked the ABUS exam. And from that, there was an abnormality found that required further ultrasound follow-up with a handheld dedicated ultrasound in the spot that the abnormality was detected. And that abnormality turned out to be a cancer. I had no family history. I had no risk factors aside from being a woman. And I had no lump, no pain, no symptoms at all. It's a really emotional and scary time. As someone who's worked in healthcare for many years, I had an idea of what was coming next, but being the patient instead of the healthcare provider is still a very different journey. My experience in healthcare helped in that I had confidence in the medical field. So I had confidence in the imaging I had. I was not angry that the mammogram didn't see my cancer. I knew that the density of my breast was what affected that, and was very grateful that I had access to ABUS to be able to diagnose it. And then moving on to next steps into biopsy and surgery and then subsequent radiation, I had such trust in all of the procedures I had. I wasn't worried about getting an infection when I had a procedure. I wasn't worried about them not getting the right sample. I had a huge confidence in the teams that were providing the care for me. I think the hardest part about being a healthcare provider and then being a patient is being more vulnerable. You have to really get comfortable in those shoes on the other side of the ultrasound probe or table or however you want to describe it. So being vulnerable with people you've worked with all your life as peers is a bit of a switch that I wasn't expecting and not entirely comfortable with. So I decided that for me to embrace being vulnerable, being the patient, and not trying to hide it or shy away from that was the best way for me. Coming into healthcare has always been about the patient. So for me, even initially moving from a technologist role to a manager role was a difficult decision because I was moving further away from one-on-one patient contact. But I always bring those decisions back to it. So I think now, having been a patient, I have more empathy for what people are feeling when they come in. I always had an awareness of that people are going through things, but just things like having anxiety around a scan or an image, or just sometimes when you go into an exam room after your diagnosis, it can be triggering and taking you back to being in that room when you were first told that that was a suspicious lesion, when you had the biopsy, when you had other results given or other procedures done. So I think just being a little bit more aware of that and giving patients space is helpful. So just really embracing what the patient may be going through and not judging it, but just letting them have that experience. My choice has been to share the journey. It probably wouldn't be everyone's choice, and I wouldn't certainly put everyone in that group. But for me, it is a bit of the therapy of going through the process, having the opportunity and the unique perspective I have from someone taking the images and now having them being imaged myself and going through the rest of the treatment, I think is valuable to help our staff and as they move forward, and our patients and all women in general, just being aware that screening and getting early screening, it can save your life. It can certainly make your journey easier if you're diagnosed with cancer. Stay strong. It's a tough journey, but there are people out there to support you. As women, we have a tendency to be the strong one, to be the person that manages through this and that and everything, and giving yourself some grace to sit with the fear, the anxiety, whatever it is that you're feeling, and knowing that it is okay. It is a perfectly normal reaction to what you're going through, and give yourself grace and love yourself. Yeah.